Today I'll be talking about the causes and treatments of ADHD. First, what is ADHD? ADHD is one of the most common neurodevelopmental disorders of childhood. It's first diagnosed in childhood and lasts into adulthood. Children have trouble paying attention, controlling impulsive behavior such as acting without thinking of results and or being overly active. Signs and symptoms of ADHD may be daydreaming, forgetting/losing things, fidgeting, talking a lot, careless mistakes, taking unnecessary risks, difficulty getting along with others. Of course, there's more symptoms or signs that may be present, but these are mostly the common ones. There are different types of ADHD. There are three main ones. First, predominantly inattentive ADHD. There are of course signs and symptoms that are attached to these, and I will talk about those in the next slide. For this type of ADHD to be present, 6 or more symptoms must be present for at least 6 months. It has to be inconsistent with the child's developmental level and have a negative effect on their social and academic activities. These are the possible symptoms for this type of ADHD. Fails to pay close attention to details, has trouble sustaining attention, doesn't seem to listen when spoken to directly, fails to follow through on instructions and fails to finish schoolwork or chores, trouble getting organized, avoids doing things that require sustained focus or thinking, loses things frequently, easily distracted by other things, and forgets things. Once again, there has to be six symptoms present in order for this type of ADHD to be diagnosed. The next type of ADHD possible is predominantly hyperactive impulsive. Once again, there has to be 6 or more of the following symptoms present, which I will be talking about in the next slide, that has to occur for this type to be present. It must be present for at least 6 months and has to have a negative effect on the child's social and academic activities. The type of symptoms that could be present are fidgets with hands and feet, squirms in chair, frequently leaves chair when seating is expected, runs or climbs excessively, trouble playing/engaging in activities quietly, acts on the go as if driven by a motor, blurts out answers before questions are completed, trouble waiting or taking turns, and interrupts or intrudes on what others are doing. The final type of ADHD that is possible is the combined/mixed subtype. This occurs when 6 or more symptoms of inattentive and hyperactive impulsive have occurred in a child. The symptoms have to be present for at least 6 months, and both types are equally present in the child. These symptoms are combined between the two that I've already spoken about in previous slides. Causes of ADHD. The causes of risk factors for ADHD are unknown. However, current research shows that genetics plays an important role. The main gene thought to be affected is the ones that encode the dopamine components of the dopaminergic, noradrenergic, and serotonergic system. Dopamine is a neurotransmitter that controls movement, learning, mood, emotion, cognition, sleep, and memory. Other causes and risk factors include brain injury, exposure to environmental risks such as lead during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, and low birth weight. Of course, there can be other causes as well. These are just the main ones. Research does not support the popular view that ADHD is caused by eating too much sugar, watching too much TV, parenting, social factors such as poverty or family chaos. These things could make the symptoms of ADHD worse, however. Diagnosis of ADHD takes several steps. There's no single test to diagnose ADHD. One step is having a medical exam, including a hearing and vision test, checklist for rating ADHD symptoms, and taking a history of the child from parents, teachers, and sometimes the child themselves. Treatment for ADHD. There is 3 different kinds of treatment that is used for ADHD. Those include pharmacological treatments, group cognitive behavioral therapy, sometimes shortened to CBTs, and psychoeducation. First, we're going to discuss pharmacological treatment. Stimulants are the most and best known, most widely used. 70 to 80% of children with ADHD have fewer ADHD symptoms when taking these fast-acting medications. Non-stimulants were approved for ADHD in 2003. They do not work as quickly as stimulants, but their effect can last for up to 24 hours. Pharmacological treatments can affect children differently and can cause side effects such as decreased appetite or sleep problems. One child may respond well, whereas another one may not. Providers may need to try different medications and doses. The AAP recommends that healthcare providers observe and adjust the dose of medication to find the right balance between benefits and side effects. Group cognitive behavioral therapy is recommended for ADHD in adolescents if symptoms remain impairing after pharmacological treatment. Limitation with this recommendation is that all CBTs are not created equal, and the guidelines do not specify which CBT groups to use for young people with ADHD. They are divided into school-based treatment and clinical-based treatment. School-based treatment focuses on helping young adolescents with ADHD improving their inattention, social, and scholastic skills. One program is the Challenging Horizons program, or CHP, and they meet 2 times a week for about 2 hours after school across one academic school year. Clinical-based treatment is used to help improve skills that can be targeted. One program that does this is the Supporting Teens Autonomy Daily, or STAND, program that has 10 one-hour parent-teen sessions. They allow the family to select 4 issues to address, and parent contracts are used, in which the parents provide behavioral contingencies based on the adolescent's use of the targeted skills at home and skill to facilitate the skills. Psychoeducation is the provision of information and advice about ADHD. They empower adolescents and their families to make fully educated decisions when it comes to ADHD. It also allows a better parent-child dynamic since everyone is better educated and well-versed on how to handle situations when it comes to children and how to interact with ADHD. Of course, there's always ways to manage the symptoms. Developing better, healthy eating habits. Eating plenty of fruits, vegetables, whole grains, and choosing lean protein sources. Participating in daily physical activity based on the child's age, of course. Limiting the amount of daily screen time when it comes to TVs, iPads, cell phones. Of course, the world's always changing and more tablets are always coming out. Getting the recommended amount of sleep each night based on the child's age. And here is my reference page at the end of my PowerPoint. Thank you for your time.